Dr. Ken Landau. Let's talk about opioid-induced constipation and how it can be treated with a new drug known as Relistor. You have to realize that opioid-induced constipation is the result of taking hydrocodone or oxycodone or any of the similar products. You take them for pain. It's estimated in the United States right now that 1 in 6, 1 in 7 people have chronic pain. It's estimated that about 3% of the people taking opioids on a long-term basis for months or years, inappropriate for the overwhelming majority of people, by the way. 38 million people take the drug on a regular basis, mostly for musculoskeletal problems, low back pain typically, maybe fibromyalgia, other kind of injuries. We know that opioid-induced constipation, or OIC, also is known as OBD, opiate bowel dysfunction. It's the most common side effect of taking the opioid. You rarely develop tolerance. As a matter of fact, it gets worse the longer you take the drugs. We know that these drugs cause a decrease in the quality of life because of the abnormal bowel habits, constipation in somewhere between 4 and 9 out of every 10 people who take the drug. We also know that there's a significant amount of chronic abdominal pain. 60% of the people suffering from chronic abdominal pain when they take these drugs, straining 60% of the people. We know that half of them are going to have fewer than 3 bowel movements a week, and because of the gastrointestinal symptoms, somewhere around 1/3 of the people are going to discontinue taking the opioids. The opioids sit on receptors inside the intestinal wall, and as a result, they prevent the intestine from propelling food from one end to the other. And as a result, the stomach doesn't work well, the small intestine doesn't work well, the large intestine doesn't work well, the material sits in there, gets dehydrated, the fluid gets absorbed, and as a result, the stool gets harder and more difficult to pass. We define opioid-induced constipation as a change in bowel function from your baseline. You have a decrease in the spontaneous bowel movements, you have to strain, sometimes you have harder stool, and you get the sense of incomplete evacuation. You can develop obstruction and impaction. The treatment has always been, well, take some more fluid, get some exercise, maybe take a little fiber. Doesn't work. Sometimes people take laxatives, and laxatives are in different kind of families. We know that there's the bulk-forming laxative, the osmotic laxative, the stimulant laxative, the surfactant laxatives. All work because they supposedly stimulate movement of the intestine, add fluid to the stool, and add bulk. Well, they don't work very well either. Actually, they don't address the underlying problem. The underlying problem is the opioids are sitting on top of the receptors inside the gut and stopping the gut from working. Well, additionally, if in the course of your normal activities you take some other kind of medicine, you make the situation even worse. So you take an antihistamine like Benadryl, or you take a medicine for overactive bladder, or you take some medicine for indigestion or gastroesophageal reflux disease, and you get even worse. So in this background, the FDA approved Relistor. Relistor is a drug approved originally in 2008 for people receiving palliative care, typically end-of-life care, and had opioid-induced constipation. But in 2014, the FDA approved the drug for people who had non-cancerous pain. Now, Relistor is a narcotic that has an additive on it that helps prevent it from getting into the brain. It's injected subcutaneously, and it's injected on the basis of weight. Most people take either 12 milligrams a day if you're average weight. If you're underweight, you take about 8 milligrams. You take it most of the time every day. Some people can take it every other day. You have to be close to a toilet because it may work very quickly. It was the first approved medicine for opioid-induced constipation. It doesn't change the pain control, but it does block the binding in the intestine. We call it a PAMORA, P-A-M-O-R-A. It stands for peripheral acting mu-opioid receptor antagonist. That's how it works. Now, it has no effect on the bowel if you don't have the opioids there. When you're going to take the drug, you have to stop a laxative for a couple days before, a couple days after, and you can have response within 4 hours in about 1/3 of the people, as opposed to about 10% with the placebo. That means in 1/3 of the people who take the injection, you're going to have bowel movement within 4 hours. Or another way of looking at it, 2/3 of the people are not. But if we look at 24 hours, about half of the people are going to have bowel movement after injection, as opposed to about 1/4 of the people who are taking the placebo. If we look at the increase in bowel movement versus the baseline, well, people who are taking a placebo have about 1.5 extra bowel movements a week. If we look at people who receive the injection every other day, and this is self-administered, then they have an average of about 2 extra bowel movements a week. And if you take an injection every single day, you have about 3 extra bowel movements a week. Or in other words, you have fewer than 2 extra bowel movements by taking this drug. Well, we also know if you look at the people who have a sense of complete evacuation, change from baseline, about 20% of the people on placebo versus about 27% of the people who are receiving the treatment. In other words, it doesn't work all that well. The side effects of the drug, well, you can develop some abdominal pain, some diarrhea, some nausea, or you can have some of the minor symptoms of narcotic withdrawal. And that's why about 10% of the people, 9% of the people, stop taking the drug. And we know that if there's a problem with the bowel wall, where it's a little bit weak, you might have some perforation. Now, there's some long-term studies, studied about 48 weeks. And while there's no cause and effect relationship during that 48 weeks of people taking the Relistor, we had 4 heart attacks. One of them was fatal. We had 1 stroke. It was fatal. 1 cardiac arrest, and 1 case of sudden death. Well, if you overdose on this drug, if you take too much Relistor, what could happen to you? Well, you can have the symptoms of narcotic withdrawal. Hasn't really been studied for more than 4 months. And the problem with the drug is its cost. It costs about $100 or more a day. In other words, somewhere in excess of $3,000 a month to take a shot every single day. Now, this drug is marketed by a company known as Valeant. Valeant has had a lot of problems recently. It's changed the CEO because of questionable ethical dealings. And as a matter of fact, the model of this company is to buy drugs relatively inexpensively and then go and boost their prices. When this drug first was marketed by Valeant Pharmaceuticals, it was relatively inexpensive. Now that Valeant has had its hands on the drug, the price has skyrocketed. Remember, $100 a day. And does it work? It works fairly well, but it certainly isn't as great as you would like. Anyway, I'm Dr. Ken Landau. Thanks for watching.